Welcome to the HBOT News Network and another conversation with Dr. Hemal Mehta. And I've really enjoyed the conversations we've been having. And I hope you're tracking this and getting some great information on his integrative medicine approach and just the amazing opportunity, I think, for individuals to heal. So welcome back, Dr. Mehta. So what a pleasure to have you back.
Thank you. I'm happy to be back here again.
They say 3 times is a charm.
That's right, yeah.
Dr. Mehta, one of the things that, I was reviewing your information is this Vibrant University. Is that how you?
Yes, Vibrant Health University.
Vibrant Health University. Can you tell us about that? It sounds very interesting.
Yeah, Vibrant Health University is an educational program that we're starting to help educate not just the public, but also providers who are interested in performing regenerative therapies, regenerative injections, and providing an alternative for patients that's just not available out there. Our medical education, as we talked before, is heavy into pharmacology and surgical techniques, but there's very, very little literature out there on regenerative therapies and regenerative treatments. There's studies, plenty of studies, especially in Europe and other countries, but here in the U.S., there's not much education that can be provided for providers. So we plan to help educate providers and the general public as well.
And so what does that look like? Is it an online thing or is it in person? How do you conduct that?
There'll be different online programs that they can watch. There'll be podcasts that they can watch. And then if they are interested, we will definitely do a live type of a program where we can come into their office or they can come to our office and we can do demonstrations. We can do teaching on how to do proper procedures, regenerative treatments, and incorporate kind of our protocols into their treatment plans.
Mm-hmm. So, one of the things that I think is so clear is that the general population is just going to traditional medicine, and I hear that all the time. That, someone I'll say, why don't you try hyperbaric oxygen? And they'll say, well, I'm going to ask my doctor, And one of the advice, one of the little bits of advice that I can give is say, well, when you see your doctor, don't ask them if it's good for you, because they're supposed to know.
Right.
Ask them what they know about it.
Right. You're absolutely right. And I think that's extremely important, because if they don't know enough about it, it's hard to give them instructions on what to do, or it's hard to provide advice if you don't have that knowledge yourself.
Yeah, so take away the pressure. They don't have to know about it.
Mm-hmm.
They can say they don't know about it.
Mm-hmm.
And I when I first learned about hyperbarics, I went and I got 3 physicals, or I got 2, and then I got a lower GI doctor, GI expert. And in the first 2 physicals, I asked the question, was hyperbaric oxygen going to help me with my high cholesterol? And they, no, that's very expensive and don't do it. They both were, almost like textbook kind of stuff. Like, you don't do it.
Right.
And then when I went to the GI, I started thinking about, well, I got to ask that question differently. And so I asked, it was a woman, young doctor, and I asked that question, what she knew about it. She said nothing, but if you learn something that's positive, tell me.
See, now that's a good answer.
Yeah.
And that's, I think, in my opinion, a proper answer for a provider to provide. If they don't know enough information, I think telling that patient, if you find out information about it, let me know how you do. I'd be very interested in knowing how you do.
So when a doctor goes and takes your course, it's a structured course?
Yes, it'll be a structured course.
Do they get a certification or something? We can say, I've been certified by Vibrant Health for these things?
Yes, we will have a certification that we are planning to develop as part of our program to say that, okay, they've had this many hours of training in this subject matter. And providing different tiers. For example, it'll be a lower tier, a medium tier, and a higher tier of education provided to these providers based on their level of expertise, based on how much knowledge they already have and how much they want to do.
So do doctors have to have a certain amount of continuing education?
Yes, they do.
So hours every year, how many hours is it?
It varies by state. Each state is different. In the state of North Carolina, we're required to have at least 20 to 30 hours per year. For example, in the state of Tennessee, I'm required to have 30 hours every 2 years. So it definitely varies by state.
Mhm. So will they be able to, would this be accredited for those hours? Is that something that?
That's our goal, is to eventually have it accredited by the appropriate certifying boards to count as continuing medical education.
Yeah, and as an engineer, as a structural engineer being licensed, I need that continuing education every year.
Right.
And for me, it's always interesting, I look for the things that are leading edge, like what's new.
Right.
Not so much code changes, but really what's the technology that people are using to build differently. And I find that the most interesting anyway.
Oh, yeah.
So hopefully you get a good following there. And so
Yeah.
we'll definitely, promote that through the HBOT News Network so people can see that, well, I guess you call it different thing, integrative or functional.
Right.
Is it
right.
functional medicine?
Yeah,
Is there a difference?
There's not really much of a difference. Integrative and functional medicine are very similar. It's basically non-traditional medicine. You can also refer to it as. I don't necessarily like the term alternative medicine because it is an alternative, but I think it's part of the core of medicine as well. It's just not as well known, so.
So integrative.
Yes.
What are we integrating?
What we're integrating is not just traditional medicine, but we're integrating things like diet, appropriate diet, supplements, taking appropriate supplements, using regenerative procedures, and proper exercises involved in all of that. A lot of times, a lot of my patients will have physical therapy, for example, and they'll tell me, oh, the physical therapy didn't work. I went for 4 weeks and it was good while I was doing it, but now my pain's not any better. It's basically because they didn't continue that exercise that was taught to them in physical therapy, and it's essential to continue that on a regular basis. The body was meant to move. For example, there's no blood flow to any joint and there's no blood flow to the disc in your back. The way they receive their nutrients is every time you move, it creates a positive and negative pressure, pumps all the good stuff in and the garbage out. Mm-hmm. So if you're not moving, you're degenerating.
So you're not opposed to there are some, well, certainly like, for example, an antibiotic. Mm-hmm. You have an infection, give them an antibiotic.
Correct. Yes, I'm not opposed to traditional medicine at all. Mm-hmm. I think traditional medicine is extremely important, but this is an addition to traditional medicine. Mm-hmm. This is another avenue to help patients, because traditional medicine doesn't cure everything. It doesn't help with a lot of different conditions. For example, there's patients that want to do things without medications, or they want to try to avoid surgery, and there are ways still to do that.
What's interesting is earlier or at some point we were talking about inflammation, and traditional medicine addresses inflammation very much with like steroids would be one thing, but there isn't a lot there. If you watch the commercials about different drugs that are it's a warning.
Right.
That may cause inflammation, and so for me, one of the discoveries when I started reading studies about hyperbaric oxygen, that term just kept coming up, inflammation, was one of the benefits why there was improvement in the patients in the studies was because of the reduction of inflammation. So I was in a conversation, I became friends with a woman that actually ended up chairman of the National Science Board. Mm-hmm. So she's a presidential appointee, top scientist and microbiologist, or PhD, and invented some amazing antibiotics. Right. So we're on the teams that did that. And so we were just having a conversation. I said, it seems to me that every indication somehow is either caused or worsened or driven by inflammation. And she just sat back and looked at me. She said, "Well, yeah, we all die of inflammation."
Right, right.
I'm just like, oh. And so when someone calls up and says, "Hey, is hyperbaric good for this?" I'm just like, okay, type it in. Hyperbaric. Yep, there's a study.
Yeah.
Yep, I guess it's good for that, whatever it is.
Right. Well, inflammation is also important. It's important to distinguish chronic inflammation from acute inflammation too, because inflammation, the inflammatory process, is an important part of healing as well. In the acute phases, that's how the body heals itself. You get a cut, the area swells, it becomes more tender, and that's inflammation driving nutrients and more blood and more oxygen to that area. When it becomes a problem is when that inflammation doesn't go away. when you have that cut and it gets healed, but the inflammation stays. That's where the problems arise, and that's the type of inflammation that we want to try to suppress or reduce. So it is important to have some inflammation as part of the healing process, but not chronic inflammation.
Yeah, it's an interesting topic that, we had an earlier discussion about the reperfusion injury.
Right.
So the injury after the injury, and to your point there, that the inflammation is not going away, and so the injury is worsening.
Right.
In fact, that can be the dominant part of the injury.
Right.
80% of the injury caused by reperfusion.
Right. Yeah, you're absolutely right. And that's what we see in a lot of, for example, traumatic brain injuries. We used to see, and even spinal cord injury, it's the inflammation, that chronic inflammation that continues, that starts to damage the good tissue. Increased swelling in an area can decrease blood flow into that area and therefore decrease oxygen to that area. So sometimes if you increase the concentration of that oxygen being delivered, it can make a huge difference. In people with brain injury, for example, we see a lot of football players now having these closed head injuries, and it's more and more common. As a matter of fact, I think just this past week there was a high school teenager in Tennessee that passed away in a football game from a closed head injury, and it's awful. It's unfortunate. You talk to parents nowadays, they're like, "Oh, I'll let them play soccer or any other sport, but they're not playing football." But if we've got something like hyperbaric oxygen therapy that can be used for patients or for players after a game, it's just as good as putting them in an ice bath, because an ice bath is reducing their inflammation throughout the body. Hyperbaric oxygen therapy can assist with that and be part of that process. I think it would be really interesting to see studies on football players post-injury or post-game having hyperbaric oxygen therapy.
Definitely with the head injuries, there are some countries that have developed ambulances that are hyperbaric chambers.
Right.
So for, and one of the earlier comments you had made about strokes and things of that nature, if you can get them immediately to get the oxygen reestablished through the plasma,
Right.
And bypass any blockage or whatever, the reperfusion injury that's preventing it, the plasma is still getting there,
Right.
but not the hemoglobin or the oxygen is not being delivered.
Right.
So.
And I think, sorry, I didn't mean to interrupt, but I think also in a chronic state too, not just sometimes in the acute phases, but in the chronic states of a post-stroke injury or any kind of traumatic brain injury, or for that matter, any kind of injury, a part of the body that's not functioning anymore, the body is, like I said, a very efficient machine. So if you're not using that part of the brain anymore, the body's shunting blood away from there. It's not getting enough oxygen. But and then that becomes a vicious cycle. The less oxygen it gets, the more the tissue dies. The more the tissue dies, the less oxygen it's going to get.
And stress, I think, is also doing that.
Oh, yeah.
It's
Yes.
preventing that. So an anecdotal theory. Okay?
Yes.
And I think you'll appreciate this because you talked about back in the desert.
Yes.
We were talking about fasting, how often people ate and everything.
Mm-hmm.
And so their bodies are in a low inflammatory state, right? Because of the fasting. And stem cells are high, and so I'm sure you eat something, you're going to absorb quite a bit of it.
Right.
So somebody breaks a bone back in the day.
Mm-hmm.
That area inflames, and they can't move it.
Right.
So that was the natural way to that was the cast.
Right. That was the cast.
That
That's
was
right.
That was the cast,
Mhm.
right?
Right.
Today, we have casts.
Right.
So getting rid of that inflammation actually can heal much faster because we get rid of the inflammation and put the cast on, the bone heals,
Right.
and we're getting all the nutrients to it, and we don't have all that inflammation that's doing that. Same
yeah.
thing with a cut.
Mm-hmm.
You get a cut, and that inflames to try and stop the blood from
Right.
going there or coming out of you, and you don't bleed out.
Right.
Okay. Today we have bandages,
Right.
so we can stop the cut. And I think one of the things, especially with surgeries, people that get hyperbaric oxygen post-surgery heal. The wound heals much faster.
Oh, yes.
For that, and so hyperbaric oxygen, is sort of come of age because of medicine coming of age, that we have all these other techniques. To your
Right.
point, integrative medicine is really integrating some of these, very functional, holistic
Right.
therapies and integrating it with what we've learned, through history.
Oh yeah, you're absolutely right. I would agree with you 100% on that.
So that reperfusion
So-
injury actually was a survival mechanism that evolved, or
Mhm.
God gave us to survive
Right.
back in the day.
Oh yeah, yeah. I agree 100% with that. It's amazing the way the body works. After studying medicine, you can't help but believe that there is a God or there's a higher power that has created this body, because it's made to be able to tolerate all kinds of different injuries, all kinds of different aspects of life in our environment, and there's no other machine that man has ever made that's even similar.
That's awesome. So Vibrant Health University.
Yes.
So
Yes.
where are you right now? Is that already started? It's
Yes, it's getting started. We're in the beginning phases of that. We're about to launch Vibrant Health University. We have several locations. Vibrant Health is located here in Raleigh, North Carolina. We have a location in Seattle, Washington, as well as in Virginia, Richmond, Virginia. Planning to open other locations in Atlanta, Georgia area, Florida, and in Tennessee. We have a location there as well.
That's awesome. I think certainly like to visit
Yes.
that. And as we say with our video, we'll get some B-roll of you at Vibrant, Health University, and plug that and push that because it's so needed.
Oh, yes, thank you. Appreciate that very much. I think getting the word out there is the most important thing. Knowledge is power, right? So the more patients and more people are aware of what's out there, the more they can get the help that they need.
Well, I certainly enjoyed our conversation, and I'm sure anyone listening to this is going to enjoy it as well.
Well, thank you. I enjoyed being here, and I enjoyed talking to you. Thank you.